He ended up having an artificial disc placed, which was a complete failure of a surgery, and ended up needing to have a fusion done instead. I'm Dr. Deuk with the Deuk Spine Institute, and I'm here to talk to you about a very, very popular and well-known public figure, Elon Musk. Most people don't know that he had spine surgery done on his neck. He had a herniated disc at C5/6. He ended up having an artificial disc placed, which was a complete failure of a surgery, and ended up needing to have a fusion done instead. The reason I want to talk about Elon Musk and draw attention to the fact that he had an artificial disc, I believe it was a Mobic C that was placed. The Mobic C artificial disc is one of the many types of artificial discs available. They're all FDA approved. The problem we're finding with these artificial discs is that patients have a lot of issues with them. Sometimes they'll pop out of the disc, sometimes they'll get loose and cause more pain. Oftentimes you get ossification called heterotopic ossification, where you're going to form bone around the artificial disc in places it shouldn't be forming. And those bones, we call them bone spurs, can actually push on nerves and cause excessive pain. So what we're seeing is that there's a large number of complications related to artificial discs, which is why we do not recommend them at the Deuk Spine Institute. We recommend you consider an alternative treatment called the Deuk laser disc repair. This is endoscopic spine surgery, and honestly, had Elon Musk done his research properly, he would have found out about the Deuk laser disc repair. With the Deuk laser disc repair, we make a 4mm incision on your neck, and we do the entire surgery through this 4mm incision using a tubular retractor system, an endoscope, and a laser. In these videos, you can see the laser is removing herniated disc fragments. In particular, this surgery right here is a C5/6 disc herniation on a patient who had a pinched nerve, which was the C6 nerve root, just like Elon Musk. And we removed the entire herniation endoscopically without fusion, without artificial disc, without any metal implants. This was all done in 1 hour as an outpatient procedure. This surgery has been available now for 16 years. It's been performed right here at the Deuk Spine Institute in Orlando, Florida. We welcome patients from all over the world. We broadcast all of our surgeries live every week, so you can watch the entire surgery and ask questions. We broadcast surgery live over our interactive platform on YouTube, Facebook, LinkedIn, and Twitter. And we're open to questions and answer sessions throughout the surgery. Hope you enjoyed this video. And remember, be very careful if somebody's recommending an artificial disc. We don't implant them for the reason that they don't really work, and they often fail and cause problems. Thanks. I'm Dr. Deuk with the Deuk Spine Institute.